I helped develop some of the 3D technology that's used in plastic surgery.
Wow.
And
That's
that
awesome.
stems from a lot of the reconstructive work. So 3D printing.
Yes.
So I've done lots of complex surgeries where I've used 3D printing. I separated conjoined twins who were attached at the head years ago.
Okay, we got to get into that. Okay, everybody, welcome back to another episode of In the Slot. I'm Moobie.
I'm Smelly.
And today we are joined with Dr. Tepper.
Good morning, guys.
Hello.
Thanks for having me.
Teppy
Of course,
Toes.
thanks for coming on. Teppy Toes.
Yeah.
Tep Meister. What a great last name.
Great last name, yeah. And he's a plastic surgeon, and we were so excited to learn from him this episode.
Yes, if you want to give a more of a formal introduction of like your actual title, we don't really know the like PhD.
I mean, Ted Meister was pretty good. I don't have that diploma on my wall. I guess the formal academic kind of background. So I'm an original New Yorker, New Jersey.
Awesome.
Went to college out at University of Michigan. Went to medical school at NYU. And then I did training on top of that at NYU in plastic surgery. I did fellowships, which is sort of additional special training in what's called microsurgery and craniofacial surgery, which is facial reconstruction. And I'm the co-founder of Greenwich Street Aesthetics, which is a plastic surgery center down in Tribeca.
That's where I live.
Yeah.
So maybe you'll
That's
have a new
local,
client soon.
Wait, that's so awesome. So, with plastic surgery, like what got you to get into this realm? Was it like a calling for you? Or it was kind of just you were at Michigan feeling things out and
Yeah, no, Michigan was definitely not taking me in the plastic surgery direction, and the football career didn't work out over there. So, I got really lucky. I got to NYU Medical School. I just knew I wanted to be a physician and maybe a surgeon. They had the world-renowned place to be in plastic surgery, and when you start seeing what plastic surgeons do, I know we can talk about all that fun and exciting stuff, but the reality of it is plastic surgeons do a whole wealth of things, anywhere from small little things to touch-ups to making people look better to really big reconstructive cases. And it's one of the few specialties that lets you use sort of that entire creative skill set.
Yeah. And
And I fell in love with it. And I still love it. And I still love doing all of those different things. I mean, that's what keeps me motivated.
was there a moment when you were studying or doing those fellowships and stuff where you saw like a big reconstruction that kind of maybe made you realize you wanted to actually do it, or like a pivotal moment where you're like, whoa, that's a whole reconstruction?
Yeah, I mean, probably when I trained at NYU, Bellevue Hospital is one of the trauma centers, and we used to see, I don't know if it's one particular case, but like those types of cases where people came in and you really had to put them back together. I mean, sometimes my mom doesn't even understand what I do.
Totally,
And I explain, I say it's like Mr. Potato Head, like we're putting the pieces back where they belong.
Yeah. I was going to say, like, do you think your job, like, circles more around physical or mental, like, emotions?
It's both. I mean, I went into it loving, like, sort of the anatomy and the aesthetics and the creativity, but the emotional stuff, the more I practice, the longer I do this, you realize there's so much emotion that behind all this. And it's equally important in what I do, understanding that.
Do you feel like you need to like make those, or I feel like if I was getting my face reconstructed, I would really want to trust my surgeon. And like, is there a routine that you do when you're getting to know a client of like, let's talk about this first? Like walk me through the steps of finding a good candidate for these big surgeries.
Yeah, I mean, so this is the psychology component, right?
Yeah.
I mean, the physical stuff is, well, let's talk about both. The physical stuff is more, am I seeing what you're seeing? Mm-hmm. So I am very much into technology. I'm very much like you have here in the studio. Like I have monitor screens everywhere in the office because what I don't want to do is have somebody in my office and just have a mirror that they hold, right? That's so archaic. Like this is one view and I don't like the way I look on this angle. What I'd rather say is here are some professional pictures of you, maybe even 3D. We could talk about that. Yeah. And what are you seeing? And let me see what you're seeing and let me tell you what I'm seeing. Let's talk together rather than at each other. And so part of the physical component is, are we speaking the same language and do we envision the same thing? So that's super important. But the second part of what you bring up is the psychology behind it, is what's motivating you to do this. And it is so important for us to make sure that the motivation behind this, what's driving you to do this, is something we can address, right? Is it a place do you really, is this the answer to what you're looking for or not?
Yeah.
And
Like
so
maybe you need therapy.
yeah, maybe. And people come in sometimes like, I'm not feeling great, and my nose look better. This is going to be sort of the answer to my confidence. And then I'm like, well, wait a second, is that really the answer, or are you just going to look a little better?
Yeah,
That's so
a little
interesting.
deeper. Yeah, I was gonna say I actually watched this movie last night called Soul on Fire, and it was about this boy. It was based on a real story. This guy named John O'Leary, and he burnt his entire body, and he had to do a lot of reconstruction, to get his skin back to living,
Square
being
one.
able to live
Yeah.
life, like, I guess, or like, is that like the kind of intensity of some of these patients that you have to work with?
Yeah, did you watch that in preparation for today?
Literally,
this
no. I
just-
actually was just on the couch and I was like really in the mood to be grounded. Like I was like, I feel like I was acting like my life was hard for a second, and I was like, I need to watch something inspiring. And then I saw this movie on Netflix, and then I was like, wait, okay, connect the dots.
Yeah, I've certainly taken care of a lot of burn patients over the years. Certainly in training, that's some of the hardest to take care of emotionally, and it's such a terrible situation, and it requires so much reconstruction. So yes, that's a big part of it. But when you think about it, like when I operate on someone, whether it's a big reconstructive case or a facelift or a breast augmentation, that day for them is one of the most important days in their life, regardless. Totally. And so as much as that stuff, like you said, keeps you, to keep you grounded, that keeps me grounded. What I don't forget is, regardless of what the procedure is, that is a really important procedure for them. Their family is all waiting for the phone call. Everything went okay. They're stressed in the same way, despite being different circumstances.
Yeah.
I was going to say that as much as we talk about these big surgeries and the big reconstructions, obviously there's easier surgeries.
Yeah.
What are some of the surgeries or procedures that are like you could do, or you've done 1,000 times, like eyes closed, piece of cake?
I was going to say sleep. I don't do surgery sleep.
But I feel like you find
which ones do you do unconscious?
And my eyes are open.
Great. Good to know.
Look, they're all unique. So to say any one surgery is a chip shot or a layup, it's not.
Okay.
But there are certainly things we do more commonly. Breast augmentation is for somebody who has, on the younger side, maybe hasn't had children, hasn't sort of fought with aging and gravity over the years, can be a little more straightforward. Noses would be the exact opposite. Noses are really, really intricate, very complex surgery.
It's because they're all sort of, every nose is different, every
So
deviated
different.
septum.
Millimeters make a huge difference for patients. And changing one part of the nose has sort of a big impact on the surrounding tissue.
On the face too, I feel like nose,
eyes,
teeth.
ears, or like, isn't that like the doctor you go to, right?
Yeah, ear, nose, and throat. Yeah,
right. So
but noses in particular, like I do a lot of noses, but I always advise friends, or elsewhere, like, you really want to go to someone who does a lot of noses, because that is not a procedure you want a surgeon who's done 1 to 10 a year.
Yeah.
Somebody should do hundreds.
And there are specific nose surgeons.
Most do that and other stuff, but you certainly want someone who has a good amount of experience doing that.
Have you ever heard of an experience or been part of an experience where someone got maybe a nose job or something and the reveal didn't go exactly like how planned? How do you deal with that? Because I'm sure some people might come in with these extreme expectations
and the reaction of
or it doesn't.
Yeah, there's so many variations of that. One is people coming from other surgeons, right, where they're not happy, and I sort of hold to this professional courtesy of not to disparage other physicians. I wasn't there for the case. I don't know what happened, so I'm very much not quick to say something was done wrong.
Yeah.
But certainly there are other cases of mine or patients who it wasn't what they expected. So the key is helping them understand. Are we on the same page? I'll give you an example. I'm very much, I helped develop some of the 3D technology that's used in plastic surgery.
Wow.
And
That's
that
awesome.
stems from a lot of the reconstructive work. So 3D printing.
Yes.
So I've done lots of complex surgeries where I've used 3D printing. I separated conjoined twins who were attached at the head years ago.
Okay, we got to get into that.
To use 3D printing.
Okay,
But I use that same technology for cosmetic surgery. So why I say that is, if somebody came in for a consultation, let's say nose, we're bringing that up. I want to simulate for them what it's going to look like. And it's not a marketing tool. I'm not trying to sell them. What I'm trying to do is understand, is this what you envision? Am I trying to hit the mark of what you envision. And if this is what we could achieve, this is a perfect nose for me.
Yeah.
Does this make you happy? Because if it doesn't, then we're not the right fit.
Yeah.
So it really helps sort of that conversation.
You're painting that like actual physical visual for them.
Are there some people who see that perfect nose that you would create and they're like, actually, no, I kind of want to keep, like, they don't agree necessarily?
Yeah. And if it's within the spectrum of what I think is still appealing, great. If it's not, if it's like an overdone nose that I don't want to be a part of, I say go find another surgeon.
Yeah.
Is that a common thing? People coming in with like having, you know, surgery blindness or too much filler, Botox blindness in this day and age?
Yeah, there's the meaning that they don't understand the severity of it, or
like have done too much, I guess.
Oh, for sure. I mean, here's the problem with fillers. I love fillers for certain things. And there are tremendously talented people who can do it. But when people see overdone plastic surgery, when they're out in the streets and they say, oh, this person looks overdone, more often than not, what they're looking at is someone who's overfilled, not over-operated on.
Okay.
Right? The overdone lips, the over-injected cheeks, that's not a surgical thing.
Yeah.
And that's just injecting what to be exactly? Like, what is filler? I guess I should know the anatomy of it all.
Well, it's a great question because there's lots of it. So
Yeah.
you shouldn't unless you study this.
I don't know. Yeah, is it like a gel?
I
Is
just know
it a
lip filler.
goo?
It's a
Is
great
it-
question. Not enough people ask because people will just sort of trust whoever they're going to get injected with whatever.
Totally.
For the most part, it's most typically hyaluronic acid, which is a safe substance, and our own body makes it, but the stuff you're injecting is artificial. What I prefer often is people injecting their own fat, which is it's liquid gold. It is a substance. And we have it, and most of us want to get rid of it in certain areas, but in the right spots, it looks very youthful. And you can imagine using that, and it's got growth factors and stem cells, and it's only beneficial for your skin.
Cool.
So that's probably the most common thing I do. today,
Is that the
fat
same
grafting.
thing? Sorry, if you want. Like, I've seen videos of people getting stuff ejected out of them, and then they spin it really fast, and then the blood separates.
Yeah, so that's exactly what it is. So
Okay.
that is a centrifuge.
Okay.
Sometimes it's for PRP, and depending what population or what part of the spin down product you're looking for. But in that, there's fluid, and there's also cells. And when you're taking out the cellular portion, that's usually for fat grafting.
Cool.
Interesting. Yeah, I was gonna say like, because you were saying like some things you love about filler, some things you don't like. What are the pros or like the good parts of filler?
So
that you
the
would
nice
recommend?
thing about filler is it doesn't require surgery, right? It's great for fine wrinkles. I don't love it as much for support. So as people lose volume or age, it's not great for that. The downside is it's great for young people like yourselves, maybe not for me, but it's not a great long-term solution because repetitive filler does cause some scarring of tissues. So I'm not saying it's not a good idea. I'm just saying it's not a forever idea.
So the people who have filler, like we were watching the Golden Globes, and so many of those women look amazing. Does that mean they have to keep getting filler over and over again, or like they let it dissolve and re-inject?
Usually you want to maintain it.
Okay.
And I agree. A lot of people look fantastic the other night in the Golden Globes.
They look great.
A lot of that is well-placed volume. And I bet a lot of it is well-placed fat grafting.
Okay. And the fat is, you prefer that because it's natural and less like hyaluronic acid.
And it's good for your skin.
In your lips too, the fat.
That and your lips can be tricky, and because fat is meant to be more like for structure and not fine particles, and so unless you're super careful, it can lead to some lumps. So I prefer filler for the lips actually.
And where do you get the fat from? Like on their body?
Usually, I'm laughing because some of the people the other night at the Globes were making jokes about this very topic, but usually the thighs or the belly.
Oh, so at the same time,
I
it's
wouldn't
kind
mind
of
that.
making you skinnier.
Yeah.
In a way. I guess it's not that much fat.
Yeah.
I had a question about lip filler. Is sometimes it migrates, or when that happens, and then people get it dissolved. Obviously, I'm like, when that happens.
There'll be like some of our friends, I guess, who have had it. Like they'll say like they have like nightmares that their filler shifts in their sleep.
Right.
So does it actually move?
Yeah, it doesn't usually if it's placed in the wrong spot. But the nice thing about filler, the right type of filler, it's dissolvable. So it is a nice sort of trial. It is something permanent might scare people.
Yeah.
So it's a good place to start.
Yeah. And what about that lip flip?
Lip
What's
flip
that?
is a little bit of filler here in the lip and a little bit of Botox to turn the lip out.
And Is that like per face or?
Is it what?
Like, would you recommend that per face?
Yeah,
or?
so it's definitely patient specific.
Yeah.
Lip flip's a catchy term, but actually I think an even better treatment now around the lips and the mouth is a lip lift.
Oh.
So if I can point to both of you out, if you don't mind, while
No,
I'm
no.
talking,
Like, please.
You can use us.
Yeah,
We'll be the
I can.
I
3D
literally said
printers.
before you walked in, I was like, I would love a lift.
Are you sure?
Lift.
Because people say this and then you start saying, and then it's like, well, I didn't. You went a little too. No, I think you both have very young looking appearances around the mouth, and one of the reasons is you show your upper teeth as you're speaking, and so as the lip falls, sometimes it gives a bit of an aged look where you're just seeing the lower teeth, but as you're looking at me and as you're speaking to me, I'm seeing a hint of your upper teeth.
Yeah.
So for
All of a
women,
sudden I'm like,
perfect amount right there. Yeah. So as people age, they sort of the shade comes down a little bit,
your
and if
face
you can
dries.
lift the lip a little bit, it's a really nice subtle treatment for aging around.
Oh, I like that. I'm
I
gonna
mean,
spread
you're
that one around
convincing
town.
us. I was going to say, like, what is, there's, do you have a question?
Yeah, can you debunk
Yeah,
something? So
sure.
I've had my lips were overfilled and they migrated. I can show you pictures. I've had it
You were calling me on
removed
the
twice.
migration thing? Okay.
And
Did you do something after that you felt like it migrated?
no, I think I went to. I
Did
think
you go for like a massage, yoga?
I think
of that?
too much too fast, and I didn't want. I don't think I wanted everything that I think they just kept like going because I would go in and I think it was getting like too heavy. It was like lowering, like what you're saying. My lip was like turning down. But then since then I've been told, and you can debunk this, that once there's like a barrier broken in your lip, forever it will migrate. Is that true?
No, totally debunk that. What I will say, you pointed out.
Debunked. Here on In the Slot.
It's official and published. What I will say, which was very valid, what I think we're alluding to, is the weight of the filler.
Yes.
Sometimes brings the lip down.
It was-
Here we are saying like the lip being up is actually a good thing. So that's for sure true.
Yeah, because I would go back and be like, I think my lips like downturn, and they're like, you need more, and I don't think more was the answer. And then I was like, get it all out.
You sound like an educated customer.
She was really excited to have you.
Passed.
I was. Well, because I feel like I wasn't happy. Like I was really miserable after also, and there was like lumps. After I can show you.
I think your lips look good. I don't know if you have filler in there,
I
but you're
don't. I
definitely
gotta
not.
That's so funny. Well, in the world of people doing lip filler and more things, and we're in the entertainment space and always looking at ourselves, and so many influencers have so much work done. Do you think there's like a certain age that people shouldn't start doing it, or what's your opinion on starting filler too young, or beauty standards and all that stuff?
Yeah, there's no hard rules in this. I think starting at a young age is fine if you're conservative about it. There is some preventative stuff. Botox is preventative in a way, because if you're not animating those muscles, the wrinkles don't get ingrained.
Yeah.
So something like that is not a bad idea if it bothers you. And it's the kind of thing, if you're not thinking about it now, when you get to 40, 50, 60, and the lines get a little more severe, well, you kind of wish you had that opportunity.
Totally.
I am very much in favor of natural results. I know people say that, but what I promise all my patients I will not make you look overdone. And a lot of that is my aesthetic. But part of that also is when they come to me. And what I mean by that is if somebody comes to me and they haven't progressed that far in the aging process, the change is a lot more subtle. So someone who comes to me and says, I have this really big neck and I want to look younger, but I don't want to look that different.
Yeah.
You're like, well, you're going to look different. I'm sorry, right?
Like you want the change.
Too far along.
Totally.
But so I actually think for people who are concerned at one point that it's going to be a big change, doing some small things earlier on is a great idea.
Yeah. That's like me with my forehead wrinkles. I really animate. But so if I were to get Botox, would I not be able to lift? Does it completely freeze your face? Like,
If it's done right, no.
Okay.
And everyone at my place knows that. And we would rather bring you back multiple times
Yeah.
and do it a little bit more stepwise than just freeze the forehead. Because you are animated and you smile. I mean,
Yeah.
the other
I like
option
to be
is
animated.
you could just stop smiling and be happy and be less happy and
Yeah.
it's great.
Yeah,
But,
and the wrinkles will go.
right.
Totally. I was gonna say, do people feel it? Some people get Botox and they say that they can feel it in there. I guess I don't feel it, but
When the Botox is there?
yeah, like the sensation of it almost.
Yeah, it is a strange sensation that people need to get used to if you haven't done it, because you don't feel the Botox. What you do feel all of a sudden is that your forehead is not working as much, if you're talking about here, to lift the upper eyelids. Or people with migraines sometimes feel like it for a short period that may worsen it. You do sense it. You don't actually feel the substance, but the change.
Like the effect. I was going to say, is there any, like you said, migraines, or some people get Botox here for TMJ? That's
probably the happiest patient that comes to our office.
People who
grind at night.
Really?
Yeah, there's a strong muscle here when if you bite down, you can feel this here. And often you could see it in people who, if they really grind for many years, that muscle can get thick and it can be uncomfortable. And if that's part of what's causing you the discomfort, you can put Botox into that muscle to help alleviate that. And people, the relief is like not immediate, as in the next day. Patients are thrilled.
Wow.
Is it like headaches that they're having, or is it just literal pain in that muscle?
It's the pain. It's the discomfort of grinding at night, and then they're waking up to the sensation. It's like your muscle was working out all night while you were sleeping.
So that's a good little hack.
I wonder why that happens. Yeah.
Maybe stress. Is that
stress can do it.
Are there any other health conditions that people go to surgery or fillers for? Not surgery, I guess, but
for what we do, I mean, Botox for migraines is a thing. Usually that's done more by neurologists. There's some medical, if you're having difficulty seeing, like doing the eyelid can help kind of open up your vision. But yeah, for the most part, this stuff's looking and feeling good.
Yeah. So I wanted to talk a little bit more about like breast augmentations, because like they've become like such a big thing. Like they're so, I feel like, normalized now. Like it's more of like, oh my God, not like that girl got a boob job, but like,
it's
will
like,
you get a boob job?
Got a boob job?
Yeah. So I was just wondering like your opinion on that increase, and like if you think that.
Yeah, I think what you're saying is happening for sure. The data suggests it, and your sense that like people around you, 100%. Yeah. There's probably a few reasons for it. One, there was concerns years ago about breast implants themselves. All of that has been put to rest. So that part of it is just the education of they're safe, right? For years, there was a concern that people who had these sort of vague symptoms that may have been due to breast implantation, and it took years of studies to show that that was not the case. So that was part of it. The second is people being more open about it.
True. Yeah.
And the third, which I'm very much in favor, is I think the overall aesthetic has changed to a much smaller breast augmentation. People talk about the Ballerina breast augmentation. I think my office loves the petite breast augmentation term.
What's the Ballerina? Like tiny implant?
Yeah, in fact, there was the esthetician in my office that had a customer come or a client come in and to get a facial. And then she had realized that she was in the office of some Instagram reel that we had promoted as the petite breast augmentation. And she's like, wait a second, this is the office. And she wanted to meet the girl who was actually the patient who did it, who was there. But this idea of smaller natural breasts is not just aesthetically, I think, a more favorable thing, but it actually prevents some of the problems that people have over the years with bigger breast implants. Wow. So your sense is 100% right.
So this isn't, sorry, for the petite one, it's not like a reduction. It's just like putting in less.
It's a more natural, exactly. And so it's putting in an implant that fits the sort of footprint of your breast without trying to get beyond the boundary or expand what your tissue can sort of hold.
Interesting.
Is it true when I've heard, because like you said, people are so open about breast augmentations. I follow this influencer now, and she's documenting her whole journey of like doing it and the recovery. And she said the surgeon, like, to know the right size, they like prop you up during surgery. Because do you tell them what you're putting in them, or you say like, hey, we're going to see which looks the best when you're under, sort of thing?
I love this topic. So this is a big one. How do you get in somebody's sort of
literally
psyche? Yes, we set them up, but let me sort of take you a step back to the consultation. First thing is there are certain implants that will fit the natural sort of footprint. It's not every size. So there is a spectrum, but you have to stay within that. The second is I love inspiration photos, and I tell people bring as many as you want. Yeah. We'll look through them.
Pinterest.
And we put them on the wall in the OR. So yes, we sit them up. And part of the sitting up is not just the size, but it's going to look different. When you sit up and your normal breast falls over it, and it sits with gravity, that's going to be different than just laying. Of course, when you lay down, your breasts don't sit differently. Right. And so we're not there. We're not going for this, like you said. We want to know how it looks when you're standing up. So sitting up's a big part of it, but inspiration is a. Can I tell you a very cool thing that just came out about this? And we're really the first office to offer this.
You heard it here.
And we've now there's only a handful of patients really in the world who have had this opportunity, which is for years, the way we size women for a breast augmentation is you come to the office, you have a sports bra, ideally one that's not padded, and we actually put the implants in the bra. And it's okay, but if you want to really understand how the breast implant's going to look, it's a terrible way of understanding it, right? It's like you just stick it in there. It doesn't actually sit under the skin. It doesn't feel like it's just moving around.
Yeah.
Put a shirt on.
Yeah.
Put your shirt on. Maybe that's how it's. And so what we've developed now is this technology where we'll do a 3D image. We'll simulate implants into your 3D sort of virtual body. And now what we print is an actual mold that you can take home and wear. Different sizes.
Wow, that's so cool.
So more importantly than the volume is actually the surface of the breast, right? Who cares if it's to you? Of course, if it's 200, 250, what it is what's it going to look like on me?
Yeah, in a tankini, I almost said in a tank top or in a dress.
In a tankini?
Yeah,
sure.
in a tankini.
Whatever you want.
But that's the idea. Or in a dress, take it home, and try it on, wear it with the article of clothing or not, and see how it looks in the mirror. And so this is going to change. This is a game changer.
That's so important because I feel like people, it's like getting a tattoo and you like wear a fake tattoo for 2 months or something like that. That's so important.
I got a question about breast augmentation.
Oh,
so yeah, finally, I felt like thank you. I needed some help over here.
I had the privilege of meeting the woman with the largest breasts on the planet in Las Vegas a couple of years ago. Here's a picture. What's the biggest that you?
I think she might be known for. I'm looking at the picture. I actually think she is known for the.
Yes,
yeah.
I mean, I wouldn't be surprised if these are the biggest in the world. Have you done anything like that? And what's the biggest you would go?
Sorry, she has implants. You think?
I'm fairly confident.
I'm going to imagine that she doesn't just have implants. There's
probably like a balloon in there.
Yeah,
she wrote, I asked her how big they were, and she said it was like something like thousands of cc's.
Yeah. Most of the standard breast implant companies don't offer anything even close to that size. They're usually 750 maximum. 1,000 is, some companies will do it for you, especially if it's saline because you can overfill it. But I have never gotten even close to anything because you're asking for trouble. You just are. Like anything with that amount of weight that the normal fold of the breast has to hold up. Other than
that's just crazy.
Yeah,
you can't even do.
It's certainly good for it's good for a picture in Vegas, but
Well, I was curious, like, how did they create the skin for that? Would you know how? Like, let's say, gun to your head, you got to do this surgery with 20,000 cc's or whatever. Think you could, and how would you get the skin to It's like 3 feet long per boob.
Yeah, well, that's why I said I think she probably had 2 feet of boob to begin with, and you were getting her the extra foot. You know, I haven't had anyone throw a gun to my head in the office asking for it, but if they did, there is something from breast reconstruction, which are expanders, which are balloons that you put in and slowly expand.
Interesting. And expand the skin to stretch it out?
Yeah, and to bring it full circle, we use it actually for burn patients sometimes if you have to recruit skin to a burned area. So you're putting a balloon deflated.
Yeah.
And then you're slowly filling that up, and that's stretching the skin for you.
And then you take the balloon out.
Correct. And
how do you do that? Do you like jab in like a pump?
We jab it in surgically. But yeah, we do it. We put the balloon in, but it's deflated. So it's just sort of like a Ziploc bag at that point. And then there's a tube or a port that you can access to fill it up.
Cool.
That is so cool.
Yeah.
I was just gonna say just how we were talking about like with the filler and stuff. So cc's, it's just saline that you're putting in as your implants, or is your implants like?
So it's saline or silicone. Saline is essentially water in a silicone shell, and you fill that up. Silicone is a set size.
What is your like go-to? When a patient comes in, do you always because I've heard of like under the muscle or like above. So is it depending on the patient, or is like your signature?
You're very educated on this stuff. You told me
I'm like,
you started with that.
I didn't know a lot. Now I'm like, wait, I know so much.
So breast implants are usually placed are placed either above or below the muscle. Okay. And there are reasons that we could spend hours talking about why. In general, if you go over the muscle, you tend to see the implant. So you need some good coverage to do that. But if you're very thin and small, going under the muscle, in my mind, gives a little bit of some extra coverage, like a thicker carpet to cover the implant.
Is there benefits for someone or not benefits? What's the better if someone's athletic and like runs a lot? Is it, oh, you should do this or do saline and not?
I prefer under the muscle most exclusively.
Okay.
But for someone who's super athletic, not running, not sort of high intensity workout type stuff, more like if you're a weightlifter, when you lift weights and move your chest muscle,
Like
the
this.
implant moves with it.
Yeah.
So for someone who's like that type of athlete, that is someone you'd want to consider going over the muscle.
Interesting. And then just piggybacking off that, so would you prefer saline or silicone when you're doing these? Or?
I always recommend silicone unless they have a reason or a concern. And usually their concerns are more, I just don't like the idea of silicone. You sort of give them the data that it's safe, but if they still have concerns, of course, saline.
Why is your pros for silicone?
Well, I just think it looks better and it feels more natural.
Yeah.
Yeah.
Saline rather, it is a bag of water. So
Yeah.
it feels like that, and you can sometimes see the edges of the implant.
When you're walking down the street, can you point out someone who has had filler work done or a boob job or something right away?
I would certainly point that woman out if we saw her on the street.
That woman's crazy.
I look, ideally, if someone's had good work, no. I mean, that's the goal, right?
Yeah.
Subtle, right?
Yeah.
That keep people guessing. But certainly overdone work for sure.
Yeah. So what's your take on, so Kendall Jenner just is going viral right now because she said she's never had any work done. Or never on her
on her face. She went on to a podcast and she was talking about how like she had never has anything done, and obviously the Kardashians are always being speculated and stuff like that. But like she was getting a lot of backlash and a lot of plastic
people are showing
surgeons.
before and after photos. Of her.
Yeah.
And like other plastic surgeons are like going on social media and like sitting there.
Yeah, I usually don't. I'm gonna do this for you guys because I'm here
you're
and we're being so candid. But I get asked all the time to talk about celebrities and did they not, and I just don't usually. But in this case, I will say, there are certain side by side photos where like when the nose doesn't thin on its own.
Yeah.
Right there, makeup can do lots of things. Skincare can do lots of things.
Gua sha.
That was right on. There's no way to contour the nose in any way that looks like that other than surgery.
Totally.
But by the way, weight loss does a lot too.
Yeah, totally.
Yeah.
And growing up, I mean, she just became a woman.
Yeah. And she was like much younger in that first picture.
Right.
She's like pre-teen, I think, or
Right. By the
something.
way, certain people do just age that
Yeah.
well.
That great. Your nose just skinny.
Right.
What do you see as I feel like there's an image, or a lot of people in movies or influencers or people online are trying to be like this certain look. What do you think that look is, or like what do they usually all want? Eyes, foxy eye, or
So it's interesting. There's terms that people want, and they may not know what it means.
Yeah.
So foxy eyes is a great one. You're showing your knowledge again on this one. Ponytail, is that another one you've heard? The ponytail.
Yeah. Where it's
Right, like of course the idea you just pull your hair back and it tightens everything, but like there's a lot more subtlety to that.
Yeah.
I think I would say the single biggest thing that impacts the face is volume right here. It's this junction between the lower eyelid and the cheek. And as people age, or as people lose weight, or the craze of everyone losing weight with weight loss medication and GLP, typically what happens is you lose volume and this descends. And so I think when people talk sometimes about facelift, or I look a little tired, and the single biggest impact you can have is injecting or adding volume. In my case, it would be fat, or for my patients, is at that junction to show to smooth the junction. You're both looking. You don't have a mirror, but I'll be your mirror. You both have a very nice junction between your lower eyelid and your cheek. But certain people who have that like half moon, that depression, they feel like there's some discoloration. That's the target area.
And is that when people get PRP under here too?
That's
I've
for skin
seen that.
quality, yeah.
And it kind of just like makes it even, or like lifts it up almost. I've seen that, and it does make a difference.
Big change for very little sort of like a very little effort.
Yeah.
Cool.
I was gonna say like, what are else your like other little hacks? So like a little hack like that.
That's a great one. The lip lift I mentioned was another another one. And then just like maintenance, a big part of what I do and our office offers is just maintenance.
Yeah.
We have a full-time esthetician in the office who this is what she is there for. It's not just around surgery, it's around maintaining a youthful look.
I'm actually getting a facial like soon today, and I'm getting microneedling.
Yeah.
Do you think microneedling has
do.
benefits to
I do.
I was on Accutane and I had really bad acne, so I have like long-term indented scars, and I looked at some research and like that helps rejuvenate.
Yeah.
I hope. But maybe I start going to Tepper.
I think it's
instead.
great. You're both invited to Tep Meister's office to come down. We have a great team of people who do that.
Yeah.
Okay. Awesome.
I was going to ask too about your team because, you know, you talk about this office and I feel like you just give such like caring, genuine vibes. Like how did you curate your team that you're working with now?
So we have a real family, kind of mentality, but it's interesting. Like I've known everyone for years in different worlds.
Love that. It's like the Avengers.
It's amazing how it all came together in terms of introductions, and I've spent years trying to find this very team of people. I'm so proud of what we have there. The woman who runs my office, actually, I had met years ago because she was running the doggy daycare place in Tribeca.
There we
Can you
go.
imagine?
Yeah.
And was just understood hospitality and people. The front desk manager, actually, I had taken care of her daughter years ago.
Wow.
And I knew she worked in healthcare, and I recruited her. And like, I could tell you stories about each individual.
Yeah.
But I have to say, I am really proud of sort of this part of what we offer, because the surgeon is, of course, an important part of it. But like the reviews that I get from patients that I'm most proud of are not like, I love my result or Dr. Tepper is the greatest, etc. It's the experience is like no other.
From start to finish.
Yeah, and that's everybody else.
That's what it's about. Yeah, you want to feel like a part of the family. I totally
100%
get
and
that.
comfortable, exactly, because like this is such a big change or just like a big decision. I feel like
It's a big decision. It's stressful. It's so you're vulnerable.
Yeah.
It's such like an intimate sort of thing. So it's so helpful to have everyone around who understands that.
who you trust.
Well, if you're listening, you can trust Dr. Tepmeister with your life. We're going to do some rapid fire, true and false, and then we have this thing called Get Stumped based on our stump right here, and it's just like a little fun questions.
All right.
Okay, true or false, when someone gets their implants out, can they breastfeed?
True.
Or when they have breast implants in, can they breastfeed?
True. Can I give more context?
Yeah.
Or we keep this just true and false.
You can do a
no,
little
you can give
context.
us. I'm curious.
True. Breast implants will not affect breastfeeding, whether they're in or whether they're out.
Wow.
Like, I think there's so many rumors around so much.
Yeah.
Or like there's more holes created and there's more like I was.
Yeah.
Okay, good to know. The next one we already talked about, but true or false, you prop up patients to know best implant size.
True.
Do plastic surgeons really fit the McSteamy stereotype?
Oh,
McSteamy.
McDreamy steamy.
McDreamy is
McDreamy was neurosurgeon. McSteamy was the plastic.
yeah, but McDreamy, I mean, my wife has a crush on McDreamy,
Yeah,
so I prefer the McDreamy
So you're
reference.
claiming him.
I think there's all shapes and sizes of people and personalities in plastic surgery.
Yeah.
I'm not. I think I like those characters. They're good doctors. There's a little bit of truth to that.
Hell yeah.
When walking down the street, what's one procedure you notice instantly?
Overfilled faces.
Then when walking down the street, what's one procedure you think most people would benefit from?
Not looking down at their phone, but that's for two reasons.
Posture.
One, get posture, but so there is some truth that hours a day of this is not good for neck. It really isn't.
Yeah.
Years and years of that.
Yeah.
The tech neck, we call that, where you're spending all day. So posture, of course, is important for your overall health, but in terms of your facial aging, your neck posture. But the other truth is, like when I was referring to looking down, like there's so much of the Instagram BS being put out there in plastic surgery.
Oh yeah,
Yeah.
like the ads,
That doesn't help.
Yeah.
like the TikTok shop stuff. And I just have a question: have you had any work done?
I have not.
Wow.
Natural. Tempeh.
Do we want to get stumped?
Yeah.
Okay, Devin's gonna read some questions now.
What do you say to people who ask what they should get done?
Who just blanketed? Yeah, I mean, if somebody comes with a very broad, what do I need? I will say nothing.
Yeah.
That's always my go-to.
Yeah.
And I want to make sure they're ready to hear otherwise.
Awesome.
What's the most trendy cosmetic procedure right now?
Maybe the petite breast dog.
Petite.
Petite breast dog.
I didn't even think about the petite ones. That's great.
And have you ever been afraid to tell people they've gone too far?
Afraid? No. Have I had to do it? Hundreds of times.
Wow.
And it's a hard conversation. And when I tell a patient that I'm not the right surgeon for them, I become the only person they will ever want to operate on them forever.
You're like, there's so many
The
surgeons
chain.
and
in
it
New
is
York.
such a hard thing to be like, I don't think I can get you where you want. And if you say that, they will never see anybody else. And it's like, can you just go see
You're
that?
like, I have a friend who.
Right.
That's so funny. Well, this has been so informative.
Yes.
We thank you for coming on. We're definitely going to do some visits to you.
You guys are, of course, invited.
And learn some more about it. We hope people listening. If you have any last words to or advice to anybody.
There's a lot of like, it's a younger demo. Like,
Yeah, I think your point's about like if you're younger and you want to consider these things, like you shouldn't be afraid of it, but you really need to be an educated customer because I know the younger demographic. There's lots of content being thrown at you. Something like this is so helpful for people to hear like the legitimacy of what we do.
Yeah.
So you need more content like this, really.
Yeah.
So thank you guys.
Of course. Thank you. Thanks for listening.
so awesome.
Comment down below your favorite parts and all the stuff. Like and subscribe. Bye.